Hi, my name is Dr. Brady Wyrick, and I'm the founder of Idaho Chiropractic Neurology. I've been in private practice in Idaho Falls since 2006, and I was the first board-certified chiropractic neurologist in Utah, Idaho, Wyoming, and Montana. I study under Dr. Michael Johnson, author of the best-selling books, What Do You Do When the Medications Don't Work? Idaho Chiropractic Neurology is the only clinic in the region offering this recovery program for the thyroid. Today, we are going to talk about our thyroid recovery program. On the left of your screen, you see a list of conditions. On the right, you can see in red a list of common threads that these conditions have. This list includes oxygen deficits, neurological misfiring, metabolic imbalances, blood sugar imbalances, cortisol imbalances, hormone imbalances, anemia, autoimmune attacks, food sensitivities, and brain imbalances. All of these threads can lead to the list on the left of your screen, including thyroid, insulin, fibromyalgia, vertigo, sciatica, chronic fatigue syndrome, peripheral neuropathy, rheumatoid arthritis, chronic neck and back pain, stenosis, irritable bowel syndrome, insomnia, Crohn's disease, celiac disease, PCOS and infertility, migraine, chronic headaches, and ADD and ADHD spectrum disorders. All cases are a combination of neurological and metabolic treatment. 60% of the problems that people have are neurologic and 40% are metabolic. The thyroid is a butterfly-shaped gland in your throat that weighs about an ounce. But some of the thyroid symptoms include fatigue, increased in weight gain even with a low-calorie diet, morning headaches that wear off as the day progresses, depression, constipation, overly sensitive to cold weather, poor circulation and numbness in hands and feet, muscle cramps while at rest, catches cold and other viral bacterial problems easily and has difficulty recovering, wounds heal slowly, require excess amount of sleep to function properly, chronic digestion problems, itchy, dry skin, dry or brittle hair, hair falls out easily, edema, especially facial myxedema, and loss of the outside portion of the eyebrows. For such a small gland, the thyroid supports several different things, including bone metabolism, immune system, brain, nervous system, endocrine system, like the adrenal glands, the ovaries, and testes, gastrointestinal function, liver and gallbladder, growth or sex hormones, fat burning, insulin and glucose metabolism, healthy cholesterol levels, and proper stomach acid. Now go back to your 6th grade biology class and look at this list and tell me what system of the body is not on that list. They're all there. The thyroid affects every cell in your body. Every single cell in your body, down to the tip of your toes, has a thyroid receptor. So the thyroid can affect everything. Do you think it's a good idea to just cut it out? No. The thyroid also cross-talks with several other systems. The thyroid and immune system cross-talk to each other. The thyroid and the gut cross-talk to each other. The thyroid and the brain cross-talk to each other. And the thyroid and the endocrine system cross-talk to each other. So you can't affect one system without affecting the other. Let's talk about a couple of thyroid basics. Your hypothalamus sends a signal to the pituitary gland via what we call TRH, or thyroid releasing hormone. The pituitary gland sends a signal to the thyroid via TSH, or thyroid stimulating hormone. TSH causes an enzyme called TPO, or thyroxine peroxidase, to stimulate the release of T4 and T3. These hormones ride a taxicab called TBG to the cells. The 4 and the 3 in T4 and T3 refer to the molecules of iodine attached to these cells. T4 needs to be converted to T3 in order for your body to use it. In the liver, 60% of T4 is converted to T3. Poor liver function will cause poor T4 to T3 conversion. So if you're not converting enough T4 to T3 because of the liver, you have thyroid symptoms. And it has nothing to do with your thyroid, it's the liver. 20% is sent to the gut to be converted from T4 to T3. If there's a problem with the gut flora, there won't be enough conversion. You'll have thyroid symptoms, and it has nothing to do with your thyroid. Then 20% of T4 is sent to peripheral cells for conversion to T3 using other enzymes. And there's a very small percentage of T4 that goes to reverse T3, which the body just gets rid of. So my point is that you can have thyroid symptoms that have absolutely nothing to do with a thyroid. So my question is, have you been told that your tests are all normal? Why? Well, the reason why your tests are normal, yet you still have symptoms, is because lab ranges are inaccurate. Too many bell curves are used. Functional lab values are sensitive. Functional lab values are more sensitive to reveal problems. Let me show you what I mean. In this slide, in the red are what we call abnormal lab values. In the middle, you can see that it says functional lab ranges. In these areas, you will find lab findings with what a doctor will say normal, but they are not. You are still sick. For example, look at this chart here. Glucose functional ranges is from 85 to 100. Traditional lab values are from 65 to 110. So you can have a lab value of 73 and be completely symptomatic, yet your doctor will say that you're normal. Thyroid stimulating hormone is the same way. Functional ranges are from 1.8 to 3.0. Lab ranges are from 0.3 to 5.7. So you can be 4.2, your doctor will say that it's normal, and you can still have thyroid symptoms. You can look at the rest of this list and look at cholesterol, triglycerides, and hemoglobin. They're all the same way. If your cholesterol is 148, your lab's going to say that it's normal when indeed there's a problem. Your triglycerides can be 149, and it could be a sign that you're insulin resistant even though your doctor can say it's normal. And a hemoglobin, you can have a lab value of 13, which your doctor would say is normal, but you still have anemia. TSH is traditionally what conventional medicine will order. But what about these others? What about T4? What about T3? What about FTI, FT4, TPO, TSH, all of these other lab values that need to be ordered? How can you possibly manage health without all the information? Burning out the thyroid gland with hormone replacement is a 50-year-old model. In order to manage your health, you need to look at the causes of the problem, not just the symptoms. Let's talk for a minute about Hashimoto's and Graves' disease. These are not thyroid problems. These are immune system problems. The immune system is attacking itself in an autoimmune process, and it's attacking the thyroid. The only way to help with Hashimoto's and Graves' disease is to treat the immune system and use proper testing. Why would your immune system do this? Well, there's two reasons. You have number one, dysregulation, number two, an active antigen. Let me show you what I mean. In dysregulation, you can get it from chronic inflammation from bad blood sugar, bad adrenal glands, hormone imbalances, neurological imbalances, and the active antigen can come from some kind of chronic infection from bacteria, viral, mold, parasite in the gut, gluten sensitivity, environmental toxins, and undigested food. Any one of these problems can lead to an autoimmune condition that attacks your thyroid. So the answer here is to not just treat the thyroid with hormones. The answer is to treat the immune system to get rid of the autoimmune condition so that your thyroid has a chance to do its job. How do you treat Hashimoto's or Graves' disease? Well, the first thing you do is remove the antigen or the cause of the dysregulation. And then you modulate the immune system using vitamin D, glutathione, krill oil, and then you remove stimulants to the dominant half of the immune system and support the non-dominant half. All of this is done through herbal compounds by Apex Energetics. I want to talk about the 6 major thyroid patterns. There's 6 possible things that could be wrong with your thyroid. Primary hypothyroidism, hypothyroidism secondary to hypopituitary, thyroid underconversion, thyroid overconversion, TBG elevated from oral contraceptives, and thyroid resistance. The problem is that here are 6 possibilities. Only one of these possibilities is treated correctly with hormone replacement therapy. So you have an 85% chance. The reason why synthetic hormones do not work in treating the thyroid is only one of these 6 patterns is actually effective in treating. The rest of you who do not have primary hypothyroidism, the medications aren't going to work. They will work for a short time, but your symptoms will soon return. So let's talk about these 6 major patterns. Number 1 is primary hypothyroidism. This means that the thyroid gland gets lazy and the pituitary gland tries to kick it in the pants by pumping extra TSH. This is the only pattern that may need hormone replacement therapies. To support, you can use the nutritional compounds you see on the right to support this pattern. The second pattern is hypothyroidism secondary to pituitary hypofunction. This means the pituitary just gets lazy. It's caused by chronic stress, fatigue, hormone pills including Synthroid, creams with estrogen, postpartum depression, pregnancy, fluctuating insulin and glucose levels causing adrenal fatigue. Again, this particular pattern is not treated by hormone replacement therapy. It's treated by nutritional support and proper metabolic protocols. Number 3, thyroid underconversion. This means the gland is making enough T4, but there's a decrease of the conversion from T4 to T3. This is what I talked about before with the liver and the gut. If it's not producing enough T4, or if it's not converting enough T4 to T3, you're going to have thyroid symptoms. It often doesn't affect TSH and probably is normal, and your blood tests would come back normal. Again, the only way to treat this is with proper metabolic protocols, not with hormone replacement therapy. Number 4 is thyroid overconversion and decreased TBG. This is caused by too much active T3 is made and is overwhelming the cells, or too little TBG, which means there's too much free T3. Why? The number one cause is insulin resistance, especially in women. The cells are not listening to insulin, so more insulin is secreted. The increased testosterone levels in females resulting in too much free T3 and too little TPG. The basis of this is there's just too much hormone, the cells become resistant to it. And the only way to treat this, again, is not with hormone replacement therapy. It's to stabilize the blood sugar and insulin via diet and nutritional compounds. Number 5 is thyroid binding globulin, or TBG, elevation. Too much TBG in the blood and thus too little free T3. And it's usually because of oral contraceptives or estrogen replacement therapy, which increase estrogen, which leads to increased TBG. Again, the only way to treat this, I've said this before, isn't with synthetic hormone replacement. It's with nutritional support and compounds. You get rid of the extra estrogen by supporting detoxification pathways in the liver. And last but not least is thyroid resistance. Pituitary and thyroid glands are fine, and so are the hormone levels. However, the hormones aren't getting into the cells. The question is why? Well, this is a chronic stress response. A chronic stress response stimulates the adrenal glands to produce too much cortisol, which causes cells to be resistant to thyroid hormones. How do you treat this one? By addressing the adrenal malfunction. Nothing to do with the thyroid. This is an adrenal gland problem that shows up with thyroid symptoms. Thyroid dysfunction is a sign of metabolic dysfunction. Proper testing in these cases is absolutely crucial. We need to look at complete metabolic panels that include complete thyroid panels. They include vitamin D levels. We need to look at your anemia. We also need to look at your kidney function. These tests are not commonly ordered by the medical world. The other thing we need to look at is immune panels. We need to see if there's an imbalance in your immune system. This test is absolutely crucial to find out if your thyroid problems is from an autoimmune condition. The next thing we need to do is adrenal stress index. We need to look at your adrenal glands and see what kind of shape that they're in to see if your adrenal glands are driving your thyroid symptoms. We also need to do food sensitivity tests. You could be sensitive to gluten, eggs, soy, yeast, and milk, and these sensitivities are winding up your immune system and driving your thyroid problems. These tests are an absolute must. We are going to leave no stone unturned in figuring out what the cause of your thyroid symptoms are. So how do I differ from any doctor that you've seen so far? We differ in that we treat patients both neurologically and metabolically. Again, we are going to leave no stone unturned in finding the exact cause of your disease. We're going to use functional medicine based on the lab findings that we see to treat your gut, your thyroid and adrenals, your liver system, your anemia, your sugar regulation, and your autoimmune. We're also going to use a comprehensive neurological workup. When your immune system attacks your thyroid, it's also going to attack your nervous system and cause damage to your nervous system. The only way to find out if that damage has been done is by doing a functional neurological exam, finding out where your weaknesses are and correcting them. Your nerves are just like muscle. If you exercise them, they get stronger. If you don't exercise them, you lose them and you get weaker. By treating you both neurologically and metabolically, we're going to give your brain what it needs to survive, fuel and activation. By treating you metabolically, we're going to remove the cause of your thyroid symptoms, and it's not just thyroid. It's not about just cutting out your thyroid and giving you hormone therapy, which is the medical model. The medical model in treating the thyroid is to drug it until you can't drug it anymore and then to cut it out. I'm here to tell you that is wrong. The correct model is to find out what's causing the problem, remove the problem, and support the healthy tissue. And by doing that, you can live a happy and healthy life. My job in this case as a clinician is to take all of these pieces of the puzzle that we've talked about, is to look at your hormones, your blood sugar, different parts of your nervous system, oxygen deprivation, and so on, and put these pieces of the puzzle on the table. My job is to then line up these pieces of the puzzle and push them together to complete the puzzle of your health so that you can live a strong and healthy life. Thank you.